Thank you for joining me today. I just want to do a brief overview of narrative therapy. It's created by Michael White and David Epstein. Kind of an overlying premise of this is that the person is not the problem is the problem. And as such, we can externalize the problem and then change our narrative around it. It's based in postmodernism, so there's no one approach to understanding people in the world. Truth is constructed. Social constructivism, and that language maintains our stories and our position, that these stories that we keep telling ourselves continue to kind of create our reality, if you will. And so what we're hoping to do in the therapy is to help people really closely examine their story and see if it's still accurate or if it's still needed and if it's working. So this post-structuralism is to question the old paradigms and truths, question the old theories. Not that there's not valuable information in the theories, but that we want to make client first and foremost and understand them deeply and then help them through active listening and questioning start to really seriously consider their stories and what they want chapter 2 to look like in their life. So part of the process of this is first joining, which we would do where we're just listening, we're getting to know the client and trying to experience their perspective of the world. And then examining patterns. So with this, what we're looking at is helping to start see exceptions to the issues they're experiencing, times when they were able to make changes or to consider new perspectives. With the reauthoring, helping people look at maybe how they've grown through hardship, maybe helping them examine, looking at post-traumatic growth, that from experiencing hardship, they've actually learned and grown as a result. And then moving on, deciding that they can tell and retell their new story to themselves. So if language is maintaining kind of our life position and stance, then if we start telling ourselves a new story, start believing this story, that's what we start creating for ourselves. There's a little bit of you can either observe reality or you can create reality. So there's a bit of that with narrative therapy as well. The moving on, there can also be a ritual of letting go and moving forward. This could literally be, hey, chapter 1, I have wrapped that one up, it's ended, and this is the beginning of chapter 2, and this is what I want in chapter 2. Okay? The therapy, we also discuss how power, gender, race, discrimination, inequality affects clients. We want to process this and see how this has affected their lives and their issues, and what they've learned and grown from this, and what they can change, what coping skills, what groups do they need to join, what advocacy will they take so that they can move forward. And as a result, we're using active listening skills and clever questioning to help folks consider like different alternatives. Like, for example, hey, in the past when you've experienced something similar to this, what helped, even if it was just a little bit? Now I probably will post another video on just different types of questions, because that's a big part of narrative therapy, to help people kind of break up their mindset and decide if that was working for them and what they want to do differently. All right, good people, I hope this was helpful. I look forward to seeing your comments, and we'll talk to you on the next video. Take good care.